Hi class, this is Molly Austin, and this will be my presentation over the Donna-Bedian model, which covers structure, process, and outcomes, and fitting quality improvement models into the healthcare setting. One model for healthcare quality measures is known as the Donna-Bedian model. It is named after the physician and researcher who formulated it, Avedis Donna-Bedian, and it is a compilation of measures known as structure, process, and outcomes that is used to assess and compare the quality of healthcare organizations. The structure measures include the physical and organizational aspects of care settings. The process measures include what providers do to maintain or improve health, and this relies on structures to provide resources and mechanisms to carry out patient care activities. The outcome measures include the impact of healthcare services or interventions on the health status of patients, including recovery, restoration of function, and survival. Application of this model suggests that establishing structural capabilities will enhance care processes that will ultimately facilitate improved outcomes. This picture provides a visual representation of what is included within each of the measures throughout the Donna-Bedian spectrum. The structure includes the environment in which care is provided, the human resources used to provide care, and the organizational policies that a healthcare facility may have in place to support quality and safety. It also includes the physical equipment and the personnel needed to improve quality. Processes are the interaction between the healthcare provider and the patient, so this involves how the provider is performing care and how the patient's receiving care. It includes what is getting done to that patient, what interventions and what treatments are being completed. The outcome measures are the effects of healthcare on patients. So examples of this include mortality, function status, and any complications that would arise from the care that was provided. Benefits to using the Donna-Bedian model for healthcare quality would be that it is a flexible model. It can be applied to diverse healthcare settings as well as various levels within a healthcare delivery system. It can be applied to structure and process for treating certain diseases and conditions in chronic disease management. It can be applied to large healthcare systems to apply overall quality and align improvement work across the system to increase the quality for a population, as well as modify structures and processes within a single healthcare delivery unit, such as improving patient flow or exchange of information. Limitations to using this model would include that the progression from structure to process to outcome is too linear and too fixed, and that in some cases it could limit how the three domains influence and interact with one another. The process measures don't always correlate with outcome measures, and connection between process and outcomes can require long-term follow-up in order to observe outcomes. The process measures may not provide for immediate correlation. In a hospital setting or even after an office visit, correlation may not be observed for months. The framework does also not incorporate patient characteristics or environmental factors, which are important in evaluating quality of care. These factors assist in understanding effectiveness of strategies within the care process and can include patient genetics, health habits, cultural beliefs and preferences, and socio-demographics. Donna-Bedian proposed a comprehensive classification of approaches to assessing the performance of ambulatory care systems. One of the major subdivisions in his program evaluation was the assessment of effectiveness in ambulatory care. He proposed that 3 attributes of effectiveness include accessibility, provider performance, and continuity. I plan to address these 3 attributes in relation to the structure, process, outcome model and how they can affect primary care practice. Under accessibility, Structure measures could include geographic factors such as distance and availability of the practice to its patients, well-defined, well-known points of entry to care, scope and nature of services provided in that practice, and system arrangements, including drop-ins, emergencies, or availability of home visits. Process measures could include timeliness or delay in seeking care and utilization patterns by time, place, type of illness, or reason for seeking care. Outcome measures could include appropriate disease diagnosis and treatment and satisfactory use of available services. The second attribute that Donna Bedian proposed in the effectiveness in ambulatory care includes provider performance. Under the structure, process, outcomes model, structure measures would include adequate time for providers to spend with patients, the amenities incorporated in the physical setup and the operations of the facility. Under the process measures, this would include the manner in which practitioners and other personnel deal with patients, concerns, courtesy, respect for the client's autonomy, as well as explanation, reassurance, support, patient education regarding illness and disease. Outcome measures would include understanding of the illness and disease process as well as the plan of care and the patient's adherence to the plan of care. Under the continuity spectrum in the ambulatory care settings, structure measures would include arrangements to assure a central coordinated source of care and arrangements for referrals and for follow-up. Under the process measures, this would include the degree of follow-up and checks on the patient's adherence to regimens. Under the outcome measures, this would include adherence to the prescribed regimens as well as the use of appropriate referrals. An example of utilizing the structure, process, outcomes model in an office-based setting would be improving information exchange related to test results conveyed from lab to provider. Under the structure measures, the office would assess current technology such as an information system that's linked with the laboratory or simply a fax machine that relays all of these results. And the office would consider structural changes such as purchasing an information technology solutions upgrade to receive and flag results that need action, or adding additional staff time to perform these duties. Process measures would include developing and initiating a standard protocol to guide how the laboratory information flows, and then designate responsibilities to staff members within this protocol. Outcome measures would include patient satisfaction with communication, timeliness of the care, and clinical outcomes dependent upon the information relayed from the laboratory to the provider, such as a patient that has a therapeutic INR due to adjustments in their anticoagulation regimen from timely lab results. Cardiovascular disease is a leading cause of death in the United States, and guidelines aimed at reducing this risk by targeting individuals with prehypertension have been in effect. The advanced practice nurse can utilize this information to create a quality initiative using the structure, process, outcomes model that focuses on improving the identification, treatment, and follow-up of patients with elevated blood pressure to reduce cardiovascular risk. Structure measures would include ensuring proper functioning of blood pressure equipment, ensuring proper training of staff that will be performing blood pressure measurements and assessing their knowledge for abnormal values, and reviewing the patient's chart for abnormal readings prior to visits, and ensuring accurate readings are being documented by staff. Process measures would include implementing serial blood pressure checks in order to recognize white coat syndrome as a potential cause for elevated blood pressure, performing patient counseling related to lifestyle modifications that will lower blood pressure, such as heart-healthy diet, exercise, tobacco and alcohol cessation, providing educational handouts to send with patients that address the areas of counseling provided, as well as the associated risks with elevated blood pressure, and requesting that patients make a blood pressure log at home and bring this log with them to follow-up visits. Outcome measures would include a decrease in patients' blood pressure at the follow-up visits, appropriate therapy initiated if blood pressure remains elevated following lifestyle modifications discussed, and an increase in the patient's knowledge surrounding elevated blood pressure and associated risk factors in developing cardiovascular disease. More than 86 million American adults have prediabetes, and 90% are undiagnosed and unaware of the condition and its effect on health. The advanced practitioners can utilize this information, and using the structure process outcomes model can create a quality initiative to screen and manage the prediabetic patient and improve quality outcomes. Under the structure measures, this would include guidelines for screening, in which the American Diabetes Association recommends screening all adults beginning at age 45 and younger adults who are overweight or obese with at least one additional risk factor, screening methods to test for prediabetes, staff knowledge and expertise, as well as education and support material available to patients. Process measures would include assessing all patients for risk factors, which could include any adult with a BMI greater than 25, immediate family history of diabetes, a history of hypertension or cardiovascular disease, and sedentary lifestyle, as well as ordering the appropriate labs if screening criteria is met, in which the American Diabetes Association says a hemoglobin A1C of 5.7 to 6.4%, or a fasting blood glucose of 100 to 125, or a 2-hour glucose tolerance test of 140 to 199 is considered pre-diabetic. Additional process measures would include assessing and treating hypertension and dyslipidemia, and counseling regarding lifestyle modifications, and education regarding diabetes prevention programs and weight loss management programs. Outcome measures would include increasing the diagnosis of prediabetes to facilitate early intervention, as well as prevent disease progression to diabetes and complications associated with the disease.